Hi, I'm Angela Kloepfer-Shapiro. I'm an internal medicine physician out at Buffalo Ridge in Erie. And I'm going to talk tonight a little bit about what it's like to visit a primary care clinic or an outpatient clinic at BCH, and to go through some of the safety measures that we've put in place to keep everybody safe when they're visiting during this time. Okay, so this first picture I just want to show you, this is our clinic waiting room. So as you can see, we've removed several of our chairs and places to sit in order to encourage social distancing in the event that we have, more than one or two people waiting in the waiting room. To that end, I also want to point out that we are doing everything we can to limit crowding, to keep people moving through waiting rooms as much as we can. But in the event that more than, a couple of visitors are in there at the same time, they are separated by social distancing by virtue of furniture placement. This is a picture that was taken at 11 a.m. During a busy day at our Erie Medical Center. And as you can see, there's nobody in the lobby. We're certainly seeing patients. People are in there. They're receiving medical care. But we're keeping the hallway, the stairways, right in front of the elevator banks nice and clear. And again, moving people right through so that they're getting seen and not congregating and exposing each other to one another. These are a couple of our patients. As you can see, they're both wearing masks. That's an important thing I want to point out. So all of the patients that show up in clinic, all of the staff at clinic, any visitor to the clinic, so a vendor or anyone coming to maybe do work around the clinic or drop off supplies, is required to wear a mask. As you can see, these two folks are wearing surgical masks. We also allow cloth masks. We don't allow gaiters or bandanas to be worn. If a patient doesn't have a mask, they are provided a surgical mask, and they can call ahead of time so that a staff member can provide one to them, so that everyone is always covered at all times. Just as a nice picture of one of our hand sanitizer stations. These exist all over the building. So you can see this is in between two of our examination rooms. You really can't turn around without seeing a hand sanitizer station. This is very important. Staff uses this before going into any room, after entering a room. Patients can absolutely use it. These also exist in hallways and at all of the doors, exits, and entrances to the buildings. And this is a temperature and symptom checking station. I believe this picture was from one of our staff members at our Boulder Heart Clinic. As you can see, she is masked up. She has signage sort of explaining what the processes are. She's ready to take a temperature. She has a hand sanitizer dispenser right there, and also wipes available to sanitize anything that may be touched. And here she is, checking the temperature. We do check temperatures of every patient who comes in, every visitor. If a patient has a family member or a caregiver with them, they are also screened for temperature at the time of check-in. And I'll also point out, before I go into some of the screening questions that are asked, we screen people for symptoms both when they schedule an appointment and then also when they arrive for an appointment. So there are two points where someone is screened for either recent contact, any symptoms, and whether or not they have any concerns that they've been around anyone who's had symptoms in the event that they might be asymptomatic. Based on answers to these questions, we do have various guidelines, time frames, and precautions put into place if someone answers yes to any question that makes us concerned that maybe they shouldn't be seen in a BCH clinic and need to seek care elsewhere, or via telehealth or video, which we'll review in a minute. As you can see in this picture, we have a woman checking in, and there's a plexiglass barrier between her and the receptionist. As you can see, both individuals wearing a mask. There's signage explaining the process, and this is in place at every outpatient clinic, similar to this. So I'm going to move now to a quick video that shows one of our patients checking in and going through some of the screening questions that she would answer at the time of check-in to a clinic.
So have you been around anybody with COVID?
No,
Have you had any symptoms like cough, fever, shortness of breath, anything like that?
no.
Have you traveled internationally over the last 30 days?
No.
Okay, you still have Blue Cross?
Yes.
Okay. And are you comfortable using a tablet checking in?
Yes, I am. Okay, great.
There you go.
Okay.
Excellent. So as you can see, that was also a quick check-in. We are encouraging people when they schedule an appointment to do an e-check-in using their Bch Portal. If someone does not have access to the portal or doesn't have a computer to enable e-check-in, they can do a telephone check-in. And so we limit, again, the time that someone is spent in the waiting room and interacting closely with anyone else. So quickly, just to review when it might be appropriate to seek in-person care, so to come into the office for a visit once you've been screened. One of these is for an annual exam. So an in-person physical exam is very important. Often blood work is done, other tests such as an EKG might need to be done, and this is the time of year when, if you're otherwise well, you get a full physical exam from your doctor and where some conditions can be evaluated or even discovered. So it's important to be seen in person. Similarly, Medicare annual wellness visits for our Medicare patients, they don't always include a physical exam by virtue of what these are. However, one is often done to thoroughly evaluate a problem that someone brings up. Oftentimes, if there's a problem brought up, then we can deal with it then with blood work or x-rays or other images if needed to prevent a repeat visit to the clinic. Rash is another example of something that often needs to be seen in the clinic in person. Rashes often need to be touched. They need to be examined closely. Vital signs are a very important part of most rash examinations and can easily be obtained when someone's visiting our clinic in person. Couple of other things, urinary tract infections, very common. Oftentimes we need to do a urinalysis or a urine dip in order to adequately diagnose a UTI, get downstream culture data. In the setting of UTI, especially with a significant illness, vital signs are very important to make sure someone is doing okay. Other reasons, joint, muscle, or bone problems. Oftentimes these types of issues require a thorough examination, maybe x-rays to be done. And again, being in person really does facilitate expeditious evaluation. This is kind of broad, but neurological or cardiovascular problems that are new, especially if a thorough neurologic examination is needed, oftentimes an EKG is needed, and there's really nothing better than listening to someone's heart with a stethoscope. And so these are sort of reasons when seeking in-person care makes a lot of sense, as long as screening has gone through. So quickly, jumped ahead, we do limit in-person visits to just the patient. The reason being is just to limit, again, crowding and to reduce the amount of people in the clinic at one time. Exceptions are made for kids or adults who require a caregiver to be present to help ask questions or get medical information. In that event, parents or caregivers follow the same screening protocols as patients. They follow the same mask requirements and distancing guidelines as patients. Quickly run through options that we have when it's not appropriate to visit the clinic, maybe because the screening tests have revealed that there is a risk that somebody has had COVID, has symptoms, or possibly has come into contact. One of the great options we have is using the secure Bch Portal to do a video visit. Patients can see and speak directly to their provider doing this. Of course, this does allow for limited visual examinations, but it does allow for some, visual examination so the doctor can actually see you. Family members or caregivers can be present on the video, and this is a benefit because they can assist as needed with maybe simple examination maneuvers as directed by the provider and as appropriate. Other options are telephone visits. These are shorter, tend to be 15-minute appointments, and they allow time for dedicated discussion of a medical condition. These are often best suited to following up on any chronic condition, maybe that you've already talked about with your doctor or your APP, or it could be a new problem that does not require a visual examination, but definitely an option to consider. Electronic visits, this requires access to the portal. A secure message conversation is basically had between your provider and you based on a pre-filled out questionnaire, depending on what your condition is. Usually takes place over several days and involves multiple back and forth conversations or messages. Just reviews a few options that you have if in-clinic or in-person visits don't work. And here is a link to the My Bch Portal, which will help you to access and get access to this to take part in any of these options.